Go ahead.
Okay, we're looking at Andy's x-rays who we treated for the frozen shoulder. Okay, so this T4, there's T10, and there's L2. We list these segments because these are the ones we're going to correct, but we're going to correct them in a specific manner. We're going to correct T4 off the transverse process. We're going to correct the T10 off the spinous process, and the L2 off the spinous process as well. Now we can dictate this off the front film, and then when we look at the lateral film or the side film, we want to look at the direction or the plane of the disc that we're going to correct it in. Okay? So now, if we look at the model, okay, we have L2. L2 PRS, which means I'm going to set it and correct it right off the corner or the right side of the tip of the spinous. Alright? And again, I'm going to use that side film, that lateral film, to know how to correct it through the plane of the disc. Okay? As you can see on Andy, that's the way I was correcting it. Same thing on T10. Okay? So we'll go up to T10. T10 will correct it off the tip of the right spinous, and again, through the plane of the disc in a specific manner. Alright? We just want to have one segment moving. Alright? Same thing on T4. As we move up T4, but now all these spinuses start to imbricate, or they start to lay over each other. Okay, but now we're on T4. We're going to look at the tip of the spinous at T3 and compare it on the X-ray, because the T3 spinous will line up with the transverse process of T4. Okay, which means either two things. I can either come across and correct it through the transverse process, or I can stay on the same side of the spine, okay, and I can correct it in that fashion through the plane of the disc. Okay? With Andy, I did stand over on the opposite side, and I used my superior hand and I corrected it through the plane of the disc. Okay? But this is how specific we want to be. We want to be on the actual structure that we want to use to correct the segment, as opposed to just putting your hand on the patient's spine and just mashing into it. Okay? But this is how the Gonstead system is specific.